Hello, everyone, and welcome to today's webinar. Thank you for joining us for today's webinar on informing policy on COVID-19 with rapid data, results and responses from the RECOVR survey in Ghana. My name is Regina Baden, and I'm a research and policy coordinator at IPA Ghana. I'll be moderating today's discussion. But right before we get into the discussion itself, I'll first of all like to talk about a few housekeeping issues. So you will find on the bottom of your screen that there's a Q&A box. We'd like you to send in your questions throughout the presentation, but we'll have a Q&A session at the latter end of the webinar. And we'll be happy really to answer as many of these questions as possible during the webinar. Secondly, the webinar is being recorded and will be made available after the session. So we are really looking forward to a very engaging discussion today. So let's get started. I'll first of all like to introduce our panelists for today. We have with us Charles Amoate, who is the Acting Director of the Academy of Leadership and Executive Training at the Ghana Institute of Management and Public Administration here in Accra. And Charles will be sharing with us policy implications of the survey's findings. Also with us today is Elliot Collins, who is the Director of Poverty Measurement at IPA. And as well with us is Madeleine Hasselman, the Country Director of IPA Ghana. Both Elliot and Madeleine will be presenting on key findings from the survey. Welcome to our panelists, and thank you so much for being here. Now, before we go into our discussions itself, I would like to talk a bit about IPA's work and how we see this survey as being part of the larger work we do. So for those of you who might not be so familiar with Innovations for Poverty Action, we are a research and policy organization. We conduct rigorous research to identify and understand what actually works, and we work with partners to ensure that evidence is used to improve the lives of people. Some of you might already be aware of this, but recently, the three of the key researchers whose work are really foundational to the approach we work with won the Nobel Prize in Economics, and we are really glad to be affiliated with these researchers. Also, as you might know, IPA is really popular because of the randomized controlled trials we conduct. And we've learned over the years that conducting RCTs is usually not enough as of itself. But we noticed that there's a need to do more beyond just conducting the research. And for this reason, our work is built around three key pillars. So we co-create research together with decision makers and practitioners who need to use this evidence to impact the lives of people. And we share evidence strategically to the right people at the right time, both globally and locally. We also work to equip decision makers to use the evidence to improve the lives of people. Our work is done through our country offices, like our office here in Ghana, where we've had a long-term presence. So IPA was registered in Ghana in 2009, and we've been present in the country for the last 11 years, working across sectors from education to agriculture to financial inclusion, social protection, and business. We have offices both in Tamale and Accra, with a team of 45 project management and support staff. And we have between 50 to 400 field staff at any point in time. So far in Ghana, we've completed 25 studies, and we have 20 ongoing ones. As you recognize, none of this work is done alone by IPA, and we work in close collaboration with a number of partners from across the globe. So we do this work with hundreds of the best researchers, both globally and locally here in Ghana. We also work closely with a vast number of partners locally who are involved in the actual implementation of programs. The work we do is simply impossible without these deep partnerships, and we really cherish the partnerships we have developed over the years. Today, we'll be sharing findings from our rapid survey in response to COVID-19. And at this point, I'd like to invite Elliot to tell us more about the RECOVR survey.
Thank you, Regina. So as Regina was saying, our asset at IPA is the wide variety of government and policy partners, as well as the a very long list of academic partners and sector experts that we work with. And so this has informed the design of our Research for Effective COVID Responses program, which we're calling RECOVR. So the RECOVR project has spanned almost a dozen countries now, and we've started by going through and curating a global hub that centralizes research and policy lessons across a massive array of COVID response research projects from different organizations. And this is a hub available for people to go and see what kinds of high quality research has been conducted thus far, not just at IPA, but at all of the major research organizations that we know of. On top of that, we have what we're calling the RECOVR Survey, which is a multi-country ambitious set of national surveys in which we're attempting to reach a more or less representative sample in as many as 8 different countries, and interviewing people on a set of sector-specific questions around health, around education, around their response to the COVID crisis specifically, as well as how it has affected them economically. And the design of these surveys has been focused specifically on how we can best help inform policy decisions. So unlike many of the other surveys that are based specifically on tracking the progress of the crisis over time, or that are focused on specific research questions for the sake of publication, our focus as much as possible has been on collecting useful data for immediate policymaker decisions. So before we get into the details of these results, we will be going slide by slide through what we think are the most important things we've learned specifically in Ghana. But I wanted to take some time to just go through the key takeaways. The first is that a significant portion of households are saying that that they are at risk for COVID-19. So this is to say that we think that the group that we have spoken to is taking the COVID-19 crisis very seriously, and yet we see that the majority of respondents don't say that they feel someone in their household is at risk of contracting it, because they say that they are following preventative measures. So that's social distancing, staying inside, away from crowded places, and of course washing their hands and things like this. And so there's a widely expressed confidence that these measures are going to be sufficient to prevent the spread of COVID-19 to each individual's household. The other really important result at the household level that we are seeing is on the economic impact of the crisis, where we see that there has been a drop from 65% to 40% or 41% of households who report working or doing any paid work, either for themselves or for an employer. So this is a significant contraction in the number of people who are working at all in the country. And of those who are still working, a significant portion say that they are either earning less or working fewer hours than they were before. And then of those who are working, or they say that their initial place of work or business has closed as a result of the crisis. So as a result, we see that almost half of respondents have said that they've had to deplete their savings or made some risky financial decision in order to cope with the crisis. So this is to say that we've documented first that this is a broadly shared economic crisis in Ghana. In fact, more so than in most of the countries that we've run into. And finally, moving on to education, we want to emphasize that we see that the majority, though very much not all of respondents with children indicate that that their children are studying at home while schools have been closed. However, on average, this amounts to a few. This amounts to a few hours per week. So this is not a perfect substitute for going to school. And in fact, digging into it, we see a significant portion saying that they are facing barriers to children getting more education, and there seems to be a lot that hypothetically could be done to improve the quality of home education while schools are closed. So, just on timeline, I think we've done our best to replace the results and the survey that we've done in the context of the broader policy response and the sequence of crises and government measures that have come into place. Specifically, I think the important thing here is to understand that our survey happened shortly after lockdowns and quarantining started. So the major public policy response around social distancing, around closures at markets and things like this, were still very fresh and very new. And compliance appeared to be, according to our data, at least relatively high when the survey was being conducted. This is important to understand the results of the survey. In particular, I think it's worth noting that at this point, some of this is retrospective, where we're understanding, where we're combining insights about the immediate response to the immediate crisis, alongside what we think are probably some persistent responses in the economy and at the household level that are going to continue over time. And it's a bit of an open question right now, which of these dominates, whether or not when we see a significant drop in wages and employment and labor force participation, for example, is that an immediate response to the economy having more or less shut down, or was that a response to an oncoming global recession that we should expect to get worse over time? And to answer this, we will be conducting a second round of surveys at some point, hopefully not too long in the future, where we can go through and update our understanding of some of these results and see, have they persisted over the past month or so, or are they getting better? So before we get into the details, I also want to emphasize some of the information about the survey itself. The dates of the survey ran for roughly 3 weeks in May, and we were using random digit dialing of a nationally representative sample of phone numbers. So importantly, and this cannot be emphasized enough, a random sample of phone numbers is not a random sample of people, both because, of course, a lot of people have more than one phone, but most importantly because a very much non-random sample of people in Ghana have no access to phones and wouldn't be contacted by a random digit dialing. As a result, we try to understand to what extent is this and I should say that our sample size was 1,357. That was based on a careful power calculation. This was out of more than 10,000 call attempts, which is typical for a random digit dialing approach. So this is, that may sound like a very low response rate, but it is typical of what you'd get in the United States or anywhere else as far as we understand. So yeah, so in terms of how representative this was, we see that we see that on average, the sample we're talking to is more male, is younger, is more heavily concentrated in urban areas, and is much better educated. This should be kept in mind. We've gone back and done some reweighting of the results. The reweighted results are not contained here, but I should say that by and large, they were not terribly different. I think the reweighted results allow us to say credibly, just looking at the results, that in most of the areas of Ghana that we were working, that this sample was giving us a good picture of the overall set of responses, and we base this simply on the fact that those who were female, those who were living in rural areas, those who were older and less educated, by and large, we are not seeing terribly different responses to most of the major policy questions there. So we find ourselves expecting that the sampling bias is not deviating too far from a nationally representative sample. Nonetheless, it is very important to keep this in mind, that that is not what we're doing here, and this is not equivalent to a national sample.
Hi, Madeleine. Could you speak to the results on health and COVID-19 mitigation?
Great, yes, thank you, Regina. So good afternoon, everyone. As I start going through the results together with Charles, I will start by sharing some of our findings on COVID knowledge and preventative behavior. What we observe is that the majority of the people in our sample are not concerned about contracting COVID because they are following preventative measures, and this will protect them. Fortunately, only very few people that we spoke to don't believe that COVID exists. Nine out of 10 respondents report washing their hands more often than before and wearing a face mask. And approximately half said that they spent the entire day at home without going out at all and without receiving visits for at least 4 days in the week before we spoke with them. Non-poor households, though we did find that women report staying at home slightly more than men. Note that it's not clear from these results whether people are following these preventative measures as prescribed. For example, we cannot tell whether people are always wearing a face mask when leaving the house or whether they are properly social distancing. Charles, what do you think these results mean for the Ghana context?
Right, thank you so much, Madeleine. Right, I think the results in itself sounds quite interesting, especially the fact that most people appear not to be ignorant of the virus. And they've also indicated, putting in the necessary measures to kind of prevent contracting the disease. There are a few issues of concern, especially to policymakers. As we can see, I know the trend indicates that the spread has been increasing over the past few weeks. And so the issue is why, if people say they are observing the necessary protocol. So I think public education is still very key. People put on masks, but the question is whether they put on the right type of mask that protects them from the virus. And I think there are specific, guidelines on the type of mask that really can protect you. We also see, issues like people put on masks and don't practice social distancing because they think the mask really protects them. So we need a combination of public education, because we believe if people are well informed about the disease and its impact, it can change behavior. And so we need a combination of those policy tools, strong public education on the virus and how it spreads, and also enforcement. And I think this is very key. We need to empower our institutions to ensure compliance with the directive from the president, making it mandatory for everybody who is in a public space to actually make sure they are in the mask, and also practicing social distance. So I think there are also concerns. For example, what do we do with people, asthmatic patients, the elderly, who may not be able to be in this mask for a long time? And so, I mean, we need to look at all this, especially the workplace environment that can identify people with such conditions, and make sure that we create a workplace environment that can protect these people. Right, so I think those are my initial remarks on this, but it looks like quite a lot is being done, especially now that schools have reopened. We told all the pupils have been provided with masks, which is a good thing, but we need to open it up, go to the market. You go to the market and our market women are not in the mask. So I think the education needs to continue in the various local languages, and of course, combined with very strong enforcement measures. Madeleine.
Great, thank you. So next we will look at economic activity and employment. In May of this year, when we conducted the survey, we see a large drop in employment compared to February, at least as per the reports of our respondents. And this was especially so in the Greater Accra region, where the government had enforced a lockdown in April. Next slide, please. More than 20% of our respondents report that their place of work or business was closed when we interviewed them in May. And respondents in the services sector were more likely to report that their places of work had closed since February, whilst respondents in the agriculture, manufacturing, and retail sectors were more likely to have experienced a reduction in earnings. Charles, that was it in terms of results here. What do you think, these mean?
Yeah, I think that is really quite serious. And well, just let me give you some information that kind of put this into perspective. 21% saying that their businesses are closed. If you take the Ghanaian economy, about 92% of businesses are SMEs. So these are small businesses. And so, actually they represent about 70% of our GDP. So it's really quite critical. So if you have 21% of these businesses closed, the impact can be very significant because they employ a lot of people. I'm very happy about government intervention. We have this $1 million that is meant to support small-scale businesses, but this is woefully inadequate. Okay, so far only 2,000 small businesses have been earmarked to benefit from this 1 million. And so the question is, what happens to the rest? And I think that we need to do more, because if we don't support these small scale industries who are contributing to 70% of GDP, it can really cost us a lot in terms of GDP growth. And so, and of course, because they employ a lot of people, especially those in the informal sector, it significantly impacts on livelihoods, because once this 21% who are closed, we now have to look at the number of people who have become unemployed because of this and how this impacts at the household level. So I think it's really quite critical. So this would then also call for different forms of social protection programs to really address individuals who have been affected because the businesses they work for have been closed down. And I think when we get to that point, I probably will make some few recommendations on some specific policy interventions for this. Okay.
Thanks, Charles. Yeah, so we did look at social protection issues, and as these are closely related to employment, income, and the closure of businesses that we just discussed, we'll look at food security and financial resilience. What we see is that almost 2/3 of our sample report increased food prices, and almost 1/3 say that shortages of food in the markets prevented them from buying food. 40% of our respondents mention having to reduce food intake. And although this is very concerning, the 40% statistic is actually comparable to those from other nationally representative surveys, such as the Ghana panel survey conducted by ISER last year. However, note that we asked people this question in May, which was still relatively early on in the crisis, and hence we need to be prepared to expect an increase in the number of households who struggle to feed themselves if unemployment figures don't go down, or if employment figures don't pick up. Next slide, please. A large number of households with children report not being able to buy the usual amount of food due to a reduction of income. And this was higher than for households without children. Knowing the long-term negative impacts of food shocks and malnutrition on child development, this figure is exacerbated by the fact that school feeding programs have stopped with the closure of schools. In response to income losses and increased prices of basic commodities, half of our respondents report having had to deplete their savings to pay for food, healthcare, and other expenses. Poorer households are more likely to report having to sell off assets, though these differences are not statistically significant. Next slide, please. Almost 1/3 of our respondents say they would struggle to find 500 cedis to pay for an emergency, and women expect to have more difficulty obtaining such emergency funds than men. Again, similar to our findings on consumption, these statistics are comparable to those from surveys in previous years. However, as the global financial crisis looms, there is a risk that these limited existing safety nets will continue to decrease. Next slide, please. The government of Ghana, as Charles just mentioned, has initiated several social protection programs to reduce the shocks related to the lockdown and the decreased economic activity. We observe, however, that only 14% of our respondents in May reported benefiting from the water and electricity subsidies. And poor and non-poor households were equally likely to report receiving COVID-related support from the government or from others. Charles,
yeah,
what are your thoughts on this?
Right, okay, so thank you. I think once again, the issue is more also about information sharing. I think the support from government to subsidize water and electricity, it's a program that is in place. Most Ghanaians who are on the prepaid electricity program automatically benefit from this. But I think we need to, there are many who still are not aware that they are receiving this, this subsidy. So I think Ministry of Information and various government agencies responsible for kind of informing the public about these policies ought to do a bit more. Water has been, you know, subsidies is 50%. Sorry, 100% actually, 50% for electricity. But this is a big challenge because it's only people who are connected to the Ghana water supply who benefit. And most of them also live in, you know, the urban areas and high income areas. But those in the slums, most of them access water through community taps. And these community taps are sometimes owned by individuals. And so they still continue to pay for buckets of water though they have been told that they shouldn't charge because the owners of the taps are not going to pay water bills. But we've heard cases where individuals are still asked to pay for buckets of water. So it's a big challenge. So you see an intervention that is meant to support poor households is not really getting to them. And I'm sure most of us who are benefiting are not the intended targets. So I think it's a critical issue. But to go back again on the issue of the food supply, I am looking at the impacts in the next few months, because now our borders are closed. It's not possible to import inputs for agriculture production. And so we need to look at how this will impact on food supply, especially getting to the end of the year, especially for production that relies on imported inputs. So these are critical issues. To have individual household not able to afford, more than 500 cedis, it's also a big challenge, because it also shows the level of poverty and also the lack of savings. So I'm sure that with what we are seeing today, where households have been affected significantly because of COVID, we need to look at our savings culture, where, even in the informal sector, government can put in some programs to encourage, individuals, even if they are in the informal sector, to save towards such period of emergencies. So these are a few issues I'd like to raise, and I think government is doing quite a lot, but there is still more that can be done. I don't know if I could talk a little bit, Madeleine, about specific social protection programs which government can take another look at. For example, we've been running LEAP for a while. LEAP is a livelihood empowerment against poverty. We need to look at the possibility of increasing the coverage. So currently we are told that about 1.4 million, out of the 2.4 households which have been identified to be poor are actually benefiting. There are two issues here. We can do something about the coverage to make sure that more households are benefiting. And number two, we need to also take another look at the amount that we pay these households. Considering the current economic situation due to COVID, prices of goods and services have really gone up. And so I think government should take another look at how much we are paying for LEAP. I know that Ministry of Gender, Children and Social Protection are working also with the Ghana Health Service for specific interventions that address the impact of COVID on health of the vulnerable. I'm told about some psychosocial support programs. Many of them have been put forward, but not much is being done currently in terms of implementing these programs. And so we are hopeful that with this data supporting these issues, it will encourage government to really start operationalizing these programs to support the poor. Thank you.
Great, thank you, Charles. So now I'll move on to our last set of findings, which are related to education. Next slide, please. Thank you. So 2 months after schools were closed, when we did the survey, we saw that the main concern of most parents was that their children are falling behind in school. 36% of primary school children and 43% of secondary school children are reported to not be spending any time on education since the schools closed. And the children who are learning at home only spend on average 6 hours per week on education. Respondents indicated that the main reason why children are not spending more time on education is the lack of supervision from adults, lack of motivation, and the lack of support from schools. In May, when we did the survey, less than a third of the children in our sample had had any contact with their school or their teachers since the schools closed in March. And most of the kids who are learning at home are using their own school books, with only about a fifth or less of the children watching educational TV or using the internet to complement their learning. Charles, what do you think this means for the children, this generation of children in Ghana?
Right. Yeah, this is a big change. So let me point out, this is something that nobody expected. COVID was never expected. So I think our preparedness was really very limited for such serious emergency situations. So we are all trying to adapt. I think a lot of lessons have been learned, and I'm sure, I mean, as a country, we are not going to be the same again because we've learned quite a lot, and I'm sure we will be much better prepared for, situations like this if they should occur in the future. The issue about, the children not being able to, do a lot of learning at home, I think the findings are quite obvious, very limited supervision. Now let's take note that, we still have a chunk of our population living in rural areas where they don't have access to, information technology for learning, internet connectivity, because the schools actually providing the support through online platforms. And in many of our, rural areas, internet connectivity is not available. Parents don't have access to smartphones. We also need, even those in the city, sometimes connectivity is a big issue. And so I think one lesson that we're learning from this, and I'm sure will inform government policy going forward, is for us to invest significantly in providing internet access. And we should not limit it only to the big cities, but also making sure internet access is as low cost as possible and accessible to even those in the rural areas. So that is important. In terms of supervision, I think we need to look at, how we can help parents to still support the children at home, because currently these parents are going back to work. Is it possible to, have parents spend a bit more time at home because the children are still at home, so that they can support them in terms of providing the supervision? So these are interventions that I think if we leave it for the private sector, it might be a challenge, but we will need very clear direction from government to make sure that our children are not left behind because of the emergency situation in which we find ourselves.
Thank you very much, Charles. And this has been a very interesting presentation. I think there's a need for us to re-emphasize some of these policy implications that Charles has been speaking about. Can we have the next slide? So as we have heard, government has really enforced and made mandatory the wearing of nose masks in Ghana. But how can we ensure that respondents are actually following preventive measures correctly? So we know that from our responses, we see that people say they are doing it, but then how do we know if they are doing it correctly? And this is one area that we need to focus on. So there's need for more of a long-term period and time concentrated on ensuring that this is happening, and more communication on the part of our government for this. Also, government has created the COVID alleviation, and this is providing subsidies and support to SMEs by COVID-19. And the program really adequate is the question here. And how do we ensure that it's providing support to those who really need it most? Thinking here about even the informal sector and people within that sector and how they might be receiving from this fund. Also, you would notice that a small percentage of respondents are taking advantage of the government provided subsidies. So how can perhaps the government make it more available to people and more accessible to people actually knowing that the subsidies exist and can benefit from it? As well, you notice that households with school-age children are particularly affected by the income losses and reduction in food consumption. So in this sense, how can maybe government provide some food rationing programs or perhaps a reinstatement of the school feeding program in some form? Lastly, you notice that children are spending only an average of 6 hours in learning per week. So how can we ensure that they do not fall behind? What measures can we put in place catch-up measures can we put in place when schools resume? And how can we ensure that children are even accessing the distance learning program that the government is implementing and other private organizations are implementing? So these are a few food for thought that we need to keep in mind. So this brings us to our Q&A session. I see a number of people have sent in very interesting questions. And if you haven't sent in yet, please use the Q&A tab below to send in your question. So we'll start off with a question here for Elliot. Elliot, the question says, what specifically makes the survey rapid? And are there any trade-offs with rigor?
Yeah, that's a very good question. When we say rapid, we mean that we tried as best as possible to get the survey out as quickly as we could, following the major policy responses. So even before we saw significant lockdowns in country, we were planning to do this survey, getting sample sizes or samples constructed and everything. The major trade-off with rigor, of course, is that I think if we were to have taken more time, we might have constructed a more representative sample, and we might have been able to take more time to go back and forth on survey design. So if you're familiar with the process by which national statistical services create national surveys, the planning can go into the years and is a highly collaborative multi-stakeholder process. This was not that. There was some back and forth with policymakers, with academics and sector experts, but we got the survey out there just as quickly as possible because we wanted to get this immediate policy response recorded. So I don't know if that's a trade-off with rigor, but it definitely changes the kinds of questions we were asking and the number of questions we were able to ask. An important follow-up is that the major constraint around rigor is due to the fact that we were using phone surveys. So this was made necessary by the fact that we were not supposed to be sending enumerators out into people's houses during a pandemic. It also allows us to field a survey more rapidly if we're doing it over the phone. That said, phone surveys have the obvious drawback that they have to be significantly shorter. And so the depth of questions, the level of qualitative understanding, and the number of follow-up questions in each section that we were able to ask is much less. And so that was the major constraint for us, was not being rapid, but being short in terms of the number of questions we were asking each respondent.
Thank you, Elliot, for that very insightful answer. Madeline, the next question says, have these results been shared with government? And what are the next steps to ensure they get in the hands of decision makers to inform government's responses to COVID-19?
Yes, thank you very much for that question. I mean, at the end of the day, that is an extremely important question because we don't want to be collecting this data just for the sake of collecting data. So we have shared these findings and actually a more detailed version of what we were able to share today with our main partners in various ministries. And what we're planning to do also after this webinar is try to organize some more focused engagements with the relevant ministries with whom we have an existing relationship, including the Ministry of Education, Ministry of Trade and Industry, Ministry of Health, and some Ministry of Gender and Social Protection, to provide a more focused set of these results, because what we presented today obviously is, cross-cutting and touches on a lot of different things, but what we do have in our data set, we can extract some slightly more in-depth results, not quite as in-depth as, if we had focused the survey entirely on a sector. So the next steps for us are to continue engaging with our government partners and our contacts in some of these most relevant ministries to talk about these results more. But we have already shared them with them before we had this webinar.
Thank you, Madeleine, for the response and the answer. Well, I now have another question, and this goes to Elliot again. Elliot, so the question here says, did you assess if there are differences by children's age or gender regarding the
I'm sorry. I was just answering that question by text as well. So,
okay.
So I may have deleted it for you, but the answer is there, and the answer is yes. That we were sure to ask up front both whether or not a household had primary school students and whether they had secondary school students. And so we were able to separate out by household, and then in a few of our questions around how much time is being spent studying in the household and what specific kinds of activities. We looked at those differences between primary and secondary. Importantly, we found that almost all of the households that had a primary school-aged student in the household also had almost all of the households with a secondary school student in the household also had a primary school student in the household. So it was actually quite rare to see somebody who had only a secondary school-aged child in the household. So we because of this, I think we saw differences in the level of studying. We saw that basically primary school-aged children are studying more, but beyond that, the intra-household responses was very highly correlated, just because you saw students of different ages in the same household together.
Thank you, Elliot, for that response. Charles, we have another question here, and it says, where do you think the government can mobilize internal resources to pay up for the unexpected increase in COVID recovery costs?
Okay, thank you very much. I think the options are very clear to government. They have to hold back capital investments, goods and services. I think the focus should be on, of course, salaries, because people must still maintain their livelihoods. But these are really critical options. I understand government is also considering drawing about 200 million from the stabilization fund to address some of these emergencies. They are also borrowing up to 10 million Ghana cedis, 10 billion Ghana cedis from the Bank of Ghana to actually mitigate some of these impacts that we have presented, right? So I think these are critical options, but we still have to see how we can work with the private sector to be able to provide some of the support to the worst affected. Right.
Thank you, Charles. Elliot, there's another question here about the survey results in terms of its comparison to other countries? I'm wondering if you could speak a bit on this.
The few countries where we have completed a detailed analysis thus far, and importantly, Ghana is one of the earlier countries that we started with because it was a high priority for us. But I think what we're seeing is that there actually are very significant differences in the way that the COVID crisis is hitting different countries. It depends heavily on the formality of the economy and the capacity of respondents to respond economically or personally by way of social distancing or not going to the household. So for example, when we compare the change in labor force participation in Ghana to that of, say, Colombia, which is a more formal economy, we see that those who are formally employed, who have salaried work with an ongoing employment contract, by and large are much less affected. They are less likely to stop working. They're less likely to be paid less. Things like this. Now that may contribute to ultimately contribute to the spread of the disease, that these contracts are, a formal contract is compelling somebody to continue going to work even when it might not be advisable. That said, I think the informality of the economy is a major risk factor because it makes the economic systems more fragile to shocks like this. And that's the overwhelming theme of the policy discussion thus far, I think, is the question of, in less formal economies, what's the appropriate way to respond to the crisis, given that there is more economic vulnerability and it will be easier to derail the major market systems, and that's being borne out in the results. So that I would say is just the first result that comes to mind on my end. On the other hand, you see things like education and preventative measures, where you also see significant cross-country differences. So this is, without digging into the cross-country analysis too much, I would just say that this kind of research is necessary because you do not have a uniform set of responses, not just globally, but even within West Africa, comparing to Francophone West African countries where we're doing analysis right now. You see the situation is very different from place to place. And so.
Thank you, Elliot, for that comparison. Madeleine, I'm being mindful of time, but I think we have a little time here for a quick question. Madeleine, how hopeful are you that governments will respond to the survey findings in the way we have suggested? And what is IPA doing to promote government intervention?
Great, thank you. Yeah, thank you for that question. I saw that coming in through the Q&A chat, and it's a very good one. So, yeah, it's difficult to know about all the suggestions. I think that Charles listed quite a few. One thing that I'm hopeful for is on education, where the findings are rather concerning. But I am hopeful because, we're already working quite closely with the Ministry of Education and Ghana Education Services, as they were already, before this crisis came, planning to roll out targeted instructions in many of Ghana's primary schools, and targeted instruction is somewhat of a remedial education program that was rigorously tested by IPA in Ghana and elsewhere and found to be very effective to bring children who are lagging behind in the curriculum, to build their foundational skills and bring them back to up to speed. And so, yes, I'm hopeful that this program that the government was already planning to roll out will receive increased attention and will help address some of these potential issues of children falling behind. So that's one area. Also, I know that many of the other ministries, such as the Ministry of Gender and Social Protection and the Ministry of Trade and Industry, and in particular NBSSI, which is managing a lot of this support to businesses, though we haven't had explicit conversations about these results and how those will feed into their programming. I mean, we've shared the results, but we haven't had an opportunity to talk through them. We have a history of engaging with these ministries, and there is very much a desire for evidence and evidence-based programming in those ministries. So from that perspective, I am hopeful that these findings, will be taken up, but it's just to see exactly, what decisions the government is able to make and what programs they're able to invest in.
Thank you, Madeleine. And definitely that is a very important issue there, especially with the Ministry of Education going back to school and ensuring that children can actually catch up when they re-enter school. So thank you very much. Unfortunately, we have only 2 minutes left on this webinar. I would like to thank everyone for joining us for this webinar today. Special thanks to our panelists for this wonderful and insightful presentations and comments. And also thank you to everyone who participated as well. This has been a very engaging webinar, you would agree with me. For more about the webinar, you can actually go to our website to find out more information. And also, as I mentioned at the beginning of the webinar, we would have a recording made available to everyone who participated today. We also welcome your questions as we continue to prepare towards the next round of data collection on this survey. So thank you very much for being here with us today, and enjoy the rest of your day. Bye.